Hello, everyone. I am actually here at, it's kind of funny. I have a little Zoom studio set up here at my Airbnb in San Antonio. I've done a few podcasts and things from here today. I'm trying to figure out where my camera goes. There we go. Um, and this is just one of my very favorite places to come is the Culinary Institute. I've never been to this campus before, so it's been kind of fun to be at this campus. And the interesting thing here, well, for those of you who don't know, the Culinary Institute of America is the top culinary school in the United States. And they have thousands of students that go. They have bachelor's and associate's programs through the Culinary Institute, but they also have what they call food enthusiast programs. So I'm at a food enthusiast program. It's so great. We get to cook in a professional kitchen. We have a chef that's our mentor through the whole thing. Learning so much, loving it. It's just always an amazing time to be here at the Culinary Institute. So I'm glad I'm here. But one of the things that I wanted to just kick off today with, one of the topics I wanted to talk about was one of the reels that was just posted. I actually recorded it a week or so ago, so I didn't know it was posted. But it's about cavities and breastfeeding, and it's set up a bit of controversy. A lot of people saying things like, I support everything you say except for this one. So I want to touch just briefly on that topic before we get to all of your questions today, because I think it's really important. You know, the reason that my partner Lindy Jones and I are so passionate about this topic, and honestly, this is the one that she leads in our practice. The reason that we're so passionate about it is because it's devastating when we have parents bring a child in, a 2-year-old, a 3-year-old child in, and their mouth was full of decay. And now we're at a really difficult place because it's impossible to do that much dentistry on a child that young. But that dental need, the tooth decay, and those other issues are going to impact growth and development. They're going to impact their ability to eat. You know, they have pain. It also could impact the developing teeth underneath. There's so many things. And so there's reasons it needs to be cared for. So you end up doing sedation. So full IV sedation for these children, and it's $4,000 or $5,000 worth of dentistry plus the cost of sedation on top of it. That is the last thing we want to have to tell a person, to tell a parent that this is now what's going to be needed for your children. So I am the biggest proponent of breastfeeding you can actually find anywhere, and so is Dr. Jones. We have done this for our own children. We recommend it for every parent and child that comes through our office, but we still see it. Even with parents who are exclusively breastfeeding, we still see tooth decay. And I know there are other issues that can play into this. There are factors like how are they latching? There are factors like gut health. But what you need to understand, and what we want to get out there, we are not bashing on breastfeeding at all. What we want to get out there is it has sugar. And sugar mixed with bacteria in the mouth create cavities. So what are you going to do about it? Well, you need to remove the sugar off of the teeth. You need to make sure that there are no bacteria on the teeth to consume that sugar. So really, oral care in a child is really important. People don't understand. Part of the issue too, and I just was researching this morning, found two very recent PubMed articles showing that prolonged breastfeeding actually has a higher risk of cavities. And let's just talk about that, because people push back on that big time too and say, what are you talking about? It's amazing. And it is. I don't contend that at all. But I just look at the science. Why? Well, when you have a newborn, there are no teeth in the mouth. So you can breastfeed all night long, and day, night, doesn't matter. It's not going to impact the teeth because there are no teeth. Typically, the teeth start to come in at about 6 months. They're easy to clean right down here. By the time you're a year old, year and a half old, you're starting to get some of the teeth in the back and more teeth. Well, really, you shouldn't be breastfeeding on demand all night long for a child that has that number of teeth, simply because of age. They are capable of sleeping for longer periods of time. By 12 months of age, by 18 months of age, they're capable of sleeping longer. So you shouldn't have to wake up to breastfeed or wake up to wipe the mouth or any of those kinds of things. It's just nature's kind of showing us the way. All right, they're able to sleep longer, so we shouldn't have to breastfeed at night. And that's where the concern comes, is when when milk of any variety, doesn't matter the kind, sits against the teeth, it is more cavity prone. So again, I am a breastfeeding advocate. I am all of these things, but we just need to understand the science and what's really happening and what I'm seeing in practice. Again, it's devastating when we see a child with a mouthful of tooth decay. Mom's only been breastfeeding, doesn't know what went wrong, and so frustrated because now it's expensive and traumatic and all those kinds of things. We want to avoid it. We just want to avoid it. So that's why we're trying to teach these things, just so that you can start thinking about them. We're not against any of this. We're for it. We just want to help you. We just don't want to see moms and kiddos have these issues. All right, enough of that. Enough soapbox today. Okay, thank you for taking our questions again. I'm so grateful that we can talk to say questions again. Is it true that if I get ozone therapy in my mouth, that all of the teeth that are currently sensitive will no longer be sensitive? Well, that's a great question. It depends on the ozone therapy. So ozone, it's interesting because when I was at the one of the very first courses I went to on ozone, I said, well, how does ozone actually desensitize the tooth? It doesn't make much sense because it's not plugging. There's little tubes that go all the way to the nerve. And if they're plugged, it'll help with sensitivity. That's why my sensitivity tooth powder helps, because it plugs with a couple of special components. Arginine bicarbonate is one of them that's in the sensitivity formula. Well, ozone, it's not going to be plugging anything. So it is analgesic, meaning it takes away a little bit of the pain. And it does, we believe, probably helps the nerves retreat a little bit so that they're not on the surface, and then it leaves an opening for you to be able to plug with hydroxyapatite. So if every single tooth that is sensitive is treated with the ozone, like the ozone gas is used on it for about 60 seconds on the surface of every tooth that's sensitive, it is true that the sensitivity will diminish down to almost nothing. But each tooth needs to be treated individually. You can't just kind of do a whole sweep of the mouth and expect that it's going to work. Each tooth that's sensitive needs to be treated individually for that benefit. Would I need to get top and bottom right side 6-year-old molars implanted in order for my TMJ implants to work on fixing that joint in my bite? I worry about getting implants because I clench and grind my teeth. I don't want more issues, but I do want to correct bite and TMJ issues to subside. So oftentimes the clenching and grinding is because of airway issues. You're not getting enough air, and because also of TMJ issues. If you have pain, then the body will respond by, you know how when you hurt your hand, you shake it, so your body responds by actually activating muscles in the area to try to dissipate the pain. So a lot of times the clenching and grinding is because of the TMJ issues, the muscle problems, the airway problems. So when you correct those, that stops. And honestly, implants aren't a concern with clenching and grinding. They have to be balanced correctly, but they're not a concern, and they will help to stabilize everything here. So implants actually are a very good thing. All right, let's jump over here into some instruments. I disappeared. I pushed the wrong button. All right, we're on the right thing here. Okay. What to do about dental erosion, other things than hydroxyapatite? Well, first of all, what's the problem with hydroxyapatite? It's going to be the thing that helps most, helps to rebuild the tooth. But the bigger question is, why is the erosion happening to begin with? Go on my website, apply or click on to get the gut health analysis, gut health evaluation, and it's going to walk you through what's going on with the gut. Usually dental erosion is gut issues. You're not digesting properly, you're fermenting, the acid's coming up onto the teeth. It's not acid reflux. That's not the problem. It's acid from poor digestion, poor digestive strength that's actually coming up, and it's causing issues on the teeth, causing minerals to be pulled from the teeth. It also can be from dietary acids. So a lot of soda, drinking lemon water all day long, those kinds of things will also pull minerals from your teeth. So make sure the erosion is addressed, and then add minerals back, which is going to be minerals internally as well as hydroxyapatite to the outside. Okay, some questions from last week. I have a question regarding infant and fluoride. I'm having twins very soon. Congratulations. First pregnancy. And if I'm unable to breastfeed, I'm trying to decide if I should use my AquaTrue filtered water for formula or tap water. All the info say kids need some fluoride. So if you have any information on that, I do have information on that. Kids do not need fluoride. Basically, you are going to be providing minerals in the form of either from breast milk if you're able to breastfeed, or from the formula. Obviously, we would like some minerals added to that water as well. So you can use that filter that takes fluoride out. Fluoride is not the panacea or the do all good that we have been taught, that I have been taught for years. We don't need fluoride. Fluoride actually creates a lot of other aspects. It affects bone development negatively. It affects thyroid. It affects IQ in babies, in kids. This is PubMed stuff. You can go check out these research articles on PubMed today. So fluoride is not the thing that we once thought it was. You do not need fluoride. So I would just simply add minerals back to that water. You can do things like concentrate, which is a real dilute form of mineral. You can add it right back to the water if you're concerned about getting minerals and strengthening the teeth that way. Both my teenagers just got their braces off and are recommending they get their wisdom teeth removed. Is this necessary? Is it just a standard process? The question is, how are they coming in? So the key is you're going to get a CT scan or what's called a Panorex. The Panorex even will show wisdom teeth. And what you want to see is, where are the wisdom teeth? First of all, how far along are they? How far developed are they? And then where are they coming in? So if they're coming in straight and there's room behind, there's basically the jaw that comes down right here and then goes across right here. If there's room in here for that wisdom tooth to erupt, then I absolutely recommend they just let them come on in. Unfortunately, because mouths are small days today, a lot of times we see wisdom teeth coming in like this sideways. And what they're going to do is run into the back of the other teeth. I actually don't believe the misnomer, the thought that they're going to push teeth and make them crooked. But what they do is they create a pocket between the very back tooth and this wisdom tooth that isn't cleanable. And a lot of times you're going to end up losing the tooth in front of it eventually because of infection and an uncleanable area. So if they're coming in like this, there's no room for them to come in naturally. I do recommend they come out. The other aspect is, if there's just no room between the back tooth and the jawbone area, if there's just no room for them and there's going to be issues in the future, then we'll recommend getting them out. So it's all based on the room for them that there is and the direction that they're coming in at. So an x-ray is going to give you that answer. What causes hypoplasia on baby's teeth, and what should you do for that? So hypo means too little. Plasia basically is development. So too little development on the teeth. So what is it? What causes it? It's usually due to some sort of fever. So if there's been a high heat incidence, it will often cause hypoplasia. In fact, I can usually look at child's mouth and say, I bet she had a really bad fever when she was about 2.5 years old. Moms are usually surprised. They're like, how did you know? And I'll say, did she have an ear infection? You know, what was going on? Yeah, when she was 2.5. It's because every tooth that was developing, the bud that was developing at that point will be affected. So I'll see it like right here in the front of the front tooth or on the chewing surface of the back molars. That's around 2.5 years old. Unfortunately, if there's a fever, there's not much you're going to be able to do about it other than obviously address the reason for the fever. But hypoplasia is often that. It's some sort of trauma or heat event in the body during the development of the tooth. So if that's the case, we watch them closely. Interestingly enough, they look like they're decayed, but they're not. And I typically recommend to don't fill them. Just get them full of hydroxyapatite. Wisdom tooth with a cavity covered in silver. Pull it or try to fix it. Well, it's up to you if you want to keep a wisdom tooth or not. So for sure, you want to get that wisdom, that old mercury filling out of there, because you say it's covered with silver, but silver is also mercury. 50% of those silver fillings are actually mercury. So you want to get that filling out of there. If the tooth is chewing, if it's healthy, if it's cleanable, leave it be. If it's not those things, then maybe it's time to get it removed. So it's really basically, can you keep it clean for the rest of your life? Can you keep it clean and healthy? If so, then fill it and keep it. Do you recommend tooth extraction and bone grafting during pregnancy? I actually do during second trimester. So why second trimester? Well, first trimester, we really don't want to do a lot during first trimester. Third trimester, you're uncomfortable laying in the chair. Second trimester, if there's an infection in the mouth, something that is going on that is warranting that tooth extraction, then absolutely it's important to get it out of there, because that infection is going to affect the baby as well. Second trimester is the time to do it. I do not remove mercury fillings, however, during pregnancy at all, because I don't want that mercury released and getting into the baby, which we've shown it does go through placental blood, and it does get shared with the baby. So we do not remove mercury fillings during pregnancy or nursing, if at all possible. If there's a massive toothache and we have to do something, we will very, very carefully, but not for preventative measures or not for health reasons. But teeth, it's okay. In fact, it's recommended to get infection out, because that will affect the baby. My son is 9 and his teeth are coming in noticeably yellow. Can anything be done? Hydroxyapatite. That is what makes teeth white, because it's the white outer material. So have him make sure he's using hydroxyapatite. And maybe he just has thin enamel to begin with. Though the tooth underneath the enamel, it's called dentin. It's quite yellow. So if he has thin enamel, it shows that dentin layer. So you need to thicken up the enamel basically. So remineralization supplements and tooth powder. My 5-year-old has multiple cavities, and my dentist is recommending several be capped with stainless steel caps. Is that the safest option? Actually, I think I answered this last week, but I'll do it real quickly again. There is a zirconia option, so you can do an all porcelain baby crown or crown on a baby tooth as well. Stainless steel is quite non-reactive. So it's the material that's used in braces as well. It is temporary. The cost is quite a bit higher on zirconia. If your only choice financially is to do the stainless steel, it's okay. But you're going to want to keep an eye on that very closely. As soon as you see any kind of bubble or anything on the gum below it, just take the tooth out. I clench in my sleep and all I hear is a mouth guard. Plastic in my mouth at night sounds like a bad idea. I'm at a loss. We need to find out, why do you clench? Usually it's because you're deficient in getting enough air at night. So you squeeze because it holds open these muscles and holds open the airway and you can breathe better. So you need to find out what's going on with the airway standpoint. I would start with a sleep study. There's really an easy sleep studies that can be done where you take it home, you do it for a couple nights at home, mail it back in or take it back to the office, and you can get a sleep reading or a sleep diagnosis even from that. How come you can go to one dentist and they say you have a lot of cavities and another dentist says you don't have any? That's a good question, and one that doesn't have an easy answer, honestly. Um, it's because of philosophy of care, some. It's because of diagnostic equipment, some, and diagnostic ability, some. Um, it was an uncomfortable situation. I was actually an associate working for another dentist for about 4 years at the beginning of my career. And he would see a lot of the patients because they knew him. They're familiar to him. And I would do a lot of the work. I would do a lot of the fillings that he diagnosed. And it started, they would come to see me to do the fillings, and I would pop up the x-rays to, verify diagnosis and which teeth and how big are they and those kinds of things. And there would be numerous cavities that hadn't been diagnosed that were quite apparent. And so I would take the x-rays to him and I'd say, hey, will you just diagnose these real quick for me? Just making sure that we're on the same page. And he would go through and diagnose it. And after I'd done that 4 or 5 times, I brought a set of x-rays. And these were the olden days where you actually had to carry the x-rays. They were film x-rays. And I took a set of x-rays over to him and he goes, oh boy, this is so fun to do. And I just looked at him and I was way too young and way too inexperienced and way too everything to really say much. I would say a lot more today. But my thought was, then just diagnose them the first time around. Why didn't he diagnose them the first time around? Because he didn't want to make his patients feel bad. He hated to tell them that they had 8 cavities. He preferred me tell them that they had 8 cavities. So he'd say, there's a couple here. We'll have you go see him, get it fixed. But he wouldn't diagnose it completely because he was worried about the way they felt about him. This is a big thing. It's called approval addiction. We all want to, have them like us. So sometimes they won't diagnose because they want you to like them. They don't want to be the one that has to give you the bad news. Sometimes it's diagnostic ability. All x-rays aren't the same. X-ray sensors aren't all the same. The computers we look at them today aren't all the same. Everybody has digital x-rays, which are more accurate, but they aren't all the same. Sometimes even just the eyes seeing them. An inexperienced eye doesn't see the same thing that an experienced eye does. It's with every profession. It works this way. So, and sometimes it's philosophy. Like I will see cavities that are still in the enamel, and I'll say we're going to watch those, and you're going to do this remineralization protocol at home, and then we're going to see you back in 6 months, and we're going to recheck them. So then, if you go to another dentist, they may say those need to be filled now. Well, that's philosophy. I believe that let's give you a chance. Let's see if you can't remineralize them if they're small enough. But another dentist may say we don't believe in remineralizing. You just need to get them filled. So lots of answers actually to that question. Are mouth guards good to use so you don't grind your teeth at night? We already talked about that one a little bit here. So mouth guards can protect the teeth from grinding, but my bigger question is, why are you grinding? You need to figure that one out first. Can you holistically heal an abscess at home? The answer is no. Or the question is, how can you? You can't. Because an abscess is it depends on the abscess. If this is a tooth abscess, you can't. Because an abscess is when the tooth is dead. It is dead. There's dead tissue inside there and it's already infected. There's no healing can go on there because you have to remove the dead tooth to be able to take care of that problem. If it's a gum abscess, on the other hand, a gum abscess can be from a deep piece of tartar that's way under the gum that needs to be cleaned out. So again, you need to go to a dentist for that. Really, there's no way to heal an abscess at home. If it's a tooth abscess, we need to remove the tooth or do a root canal, which I don't recommend, but that is an option. For a gum abscess, usually there's something down below that we need to get out in order to heal that. I'm on a tight budget and have some work to be done. Should I prioritize the ozone on a tooth that needs to come out and have a standard dentist work on the fillings? I cannot biologic dentists for it all. Yes, I think that's a great way to do it. Ozone for a tooth that needs to come out because you want to make sure that bone heals properly, or you're going to be looking at further dental treatment in the future. So yes, prioritize what's going to happen with that tooth coming out. Fillings, there are some things we do differently, but fairly standard of care other than removing mercury fillings. If you're removing mercury fillings, there is no substitute for a biologic dentist that's going to do it safely. Do not do it. Do not do it at a regular dentist, period. Don't do the fillings. Just don't remove them if you're not going to have them done safely. So those are pretty much the priority levels that I say. If it's a regular cavity, a regular filling, most dentists are going to do something similar to us. We do have other things we do, but it's going to be similar enough. Removing a tooth, removing mercury, don't do it elsewhere. Is it always necessary to pull abscess teeth in a toddler? If they're abscessed, you can do a baby root canal, but there's the same concern with a baby root canal as there are with adult root canals. So usually in a toddler, we're going to take out a tooth that's already abscessed. What if that wisdom tooth is on a nerve? Good question. So this is why we look at wisdom teeth in young kids, because we want to get them before they're already grown around the nerve. If it's around a nerve, then you have to weigh risk versus benefit. You say, okay, what's the risk of removing this tooth and having permanent nerve damage versus what's the risk of having this tooth stay and losing the tooth in front of it? So those are risks that you're going to have to discuss with your dentist and weigh which one is the bigger risk for me. I have a 10-year-old with autism. They held him down to fill his cavity. 2 years later, the filling is gone. How can I treat this tooth? Well, if they had to hold him down to do the work, which I'm sorry, that's one thing I've committed to doing, is never holding someone down for the work. And I'm going to tell you, mamas and dads both, that this is a lot of the reason the dentist will say, let's do this with sedation. And you push back sometimes on us. And I'm going to tell you why not to push back. This is the exact reason right here. You push back and say, oh, I don't want to do sedation. I don't want to do sedation. Well, I want to tell you the challenge of working on a child that maybe can't hold still, because of cognitive reasons or age reasons. They just can't hold still. They can't do it. So what the concern is number one, it's dangerous because we have sharp things we're using, needle pokey things, sharp things, we have sharp things that are moving around in there. And if they're moving around, it's dangerous. Second thing is that the things that we're using, if they're moving, we're not going to do a good job of filling that tooth, of taking care of that tooth. We might slip, we might nick something that we don't intend to do if they're moving all around. Well, that's dangerous from a care of that child standpoint as well. And then the third reason is, there's four reasons. Third reason is it's incredibly traumatic for the dentists too, and for the dental team. We don't like having to hold anybody down and the child screaming and all those kinds of things. Like, that's terrible for us. We feel terrible inflicting that kind of thing on a child because of all the adults that come to us and say, my dentist held me down when I was a child and I have been terrified of the dentist ever since. Well, I've committed to never be the dentist that they talk about as an adult. So don't ask us to do this. We don't want your child to be impacted for the rest of their dental career, the dental life from this. But the fourth thing is that we're going to hurry. We're going to hurry. And if their tongue's moving around, we're trying not to cut into their tongue, but it's moving and their saliva all the place. We're going to hurry, right? We're going to try to get done fast. And they're moving all over the place. And that filling is not going to be up to par. I'll just tell you right now, it's not going to be up to par. So do not ask your dentist to hold your child down. Do it. Well, just do it. Just get it done. Well, it's not going to be good work. I'm sorry. It's just not. There's no way we can do good work in that situation, in that scenario. So let us do some sedation. We'll do it very safely. There's safe ways to do this. That way we're fast. We're in and out of there quickly. The work is done right the first time. You're not going to have to do it again. And there's no trauma for your child from this procedure. Okay, when a tooth is dissolving from the inside out, is the bone infected and can it cause muscle and neck pain? Well, when it's dissolving from the inside out, it usually doesn't cause muscle and neck pain, and the bone isn't infected until it's gone to the nerve. If it's gone to the nerve and the nerve is dead, then yes, it's an abscessed tooth at that point, and it can cause all of those things. So that's the question, is the tooth still alive? Do we place an implant the same day as extraction? Sometimes, but actually very rarely. The reason is it's just like a piece of wood. I'm having a hard time figuring out how to get on this camera here. So it's like a piece of wood. And if you're going to put a screw in that piece of wood, you need to have enough wood that there's wood on either side of the screw. Well, when we take out a tooth, there's often big deficits of bone. There's big places where the abscess is eating away bone. Lots of issues. And also we're taking a tooth out that's this big around and we're putting an implant in that's this big around, So there's not bone to hold and secure that implant in place. So we will do same day ones on the front ones because we want that bone to stay there. We want to hold it out and hold it in place. But oftentimes on the back, we're going to do bone grafting at the time the tooth comes out and then put the implant in later. Are we sure cheaper composite fillings are allergy friendly or don't cause MCAS? For sure. Hope profits aren't being put over 24 exposure safety, 100%. So cheaper composite fillings I've learned this from an MCAS patient. What is MCAS? It is mast cell activation syndrome. Basically, it's your body's immune system and immune cells really on high alert and being so reactive to everything. Well, I have a patient who's incredibly sensitive and has MCAS. We took out titanium implants on her. She felt phenomenally better, then placed one small composite filling. All of a sudden, she just dove again and her health tanked. And I thought, what in the world is going on? I talked to all the manufacturers and they said, no, there's no titanium in there. Her husband finally did a huge deep dive and found out there's titanium dioxide. That is what makes the filling white. So there are very few composite fillings that don't have that in it. In fact, almost none. We're searching for one right now, trying to find one for this patient and almost can't find them. So there are BPAs in almost everything. That's part of a composite filling. So there are reasons, but when you talk about profits being put over 24/7 exposure, it's actually not profits. This isn't the concern. The concern is that the procedure is going to be more expensive if we don't use composite because we'll have to use porcelain. And then porcelain, what you don't realize is that porcelain has to be cemented in place. And what do we use to cement it? A composite resin. So we are not able to do it without composite resin ever, unless we use gold, which is going to be problematic from an allergy standpoint. So believe me, I have jumped down this rabbit hole very, very deep, and I know the answers that probably many dentists don't. Is that honestly, most composites going to have BPA, most composites going to have titanium dioxide. So if you're concerned about that from an allergy standpoint, there really isn't a good solution other than porcelain, which will then use a small amount of composite, which will have BPAs and titanium dioxide in it, but a lower amount. So that may be the benefit. So it's actually not about profits at all, because profits for us are very low on composites. It's usually about expense to you. Do you want to incur the expense of the more expensive porcelain with the knowledge that there still is going to be a little composite cementing it in place? So it's all just about materials and material knowledge. What do you think about hydroxyzine before a filling appointment? So hydroxyzine is going to be just basically a sedative of sorts, or it's an antihistamine. So it is going to calm down any allergic reaction. You can do it if you want. That's fine if you're concerned about it. It'll actually make you a little more relaxed. So maybe that's a good thing. Is there another option to removing a tooth close to a nerve? There isn't. There actually is a procedure that they call, basically they remove the top part of the tooth, but leave the roots behind. Well, that's going to cause nothing but an abscess tooth. So there isn't a way to remove a tooth close to a nerve other than just safely, very, very carefully and safely removing it. Is there a way to heal the tooth before filling and removing for young children? Absolutely, if the cavity is still in the enamel. So if the cavity is still in the enamel, we 100% believe that you can remineralize that very carefully with hydroxyapatite and minerals on the inside. Minerals, vitamin D and K on the inside, hydroxyapatite on the outside. Those are the key components. I just had 4 corroded titanium implants taken out. What would you advise post-treatment to ensure no infection? My dentist told me my body will take care of it. That's a true statement, but you're going to want to make sure more than anything now that the infection will often leave, but you want to ensure bone growth. So hopefully you had stem cells or what's called PRF done at the time of that removal. If not, you're probably going to want to get it checked about a year out to make sure that bone healed properly. But you want to do lots of vitamin D and K, vitamin D3, K2, and minerals. Anybody's wondering about this, go check out my remineralization supplements. You don't have to buy them from me. Buy something that's similar. I don't care. But it at least shows you what proportions of things you're going to need. Okay, lots of questions. I'm going to jump over here. So I need to remember I'm on Abfractions. I'm going to jump over here and see these real quick. Do we need to reload the toothbrush when we're brushing, or is one time enough? One time's enough. So what you do when you start to brush is you're going to brush it across all of the teeth first, kind of distribute it across all the teeth, and then start brushing. So there's enough everywhere in the mouth. And obviously you're going to kind of, it's going to mix with saliva and it'll mix in. How do you find and fix airway issues? So we find and fix airway issues through a cone beam CT scan. Cone beam CT scan to identify, is this a tissue issue? Is it because you have infection in the mouth that's causing tissue to swell? Is it a structural issue, a bone issue? Do we need to actually do some expansion to make more room for your airway? So cone beam CT scan is the start. What brand of disposable gloves do you guys use? That's a great question. I think we use one called Cranberry. It's a nitrile glove. We don't use any latex anymore. I believe it's Cranberry. But you know what? We may change. Actually, they're blue now. We use blue ones, and I don't even know the brand. I apologize. I don't order them. How long or difficult is the recovery from a sinus lift? I need to have a sinus lift and then have an implant bridge placed in teeth 12 to 14 is 3 months long enough to wait. No, sinus lift, typically you're going to need to heal for 6 months in order for that bone to really establish itself enough to then place the implants in. So a sinus lift is when there's not enough room on the top jaw for an implant to be placed below the bottom of the sinus. So we actually lift the sinus up and place a bone graft in there. Typically 6 months is what's necessary for that bone graft to heal properly. Will dental ever be included in healthcare? Which it should. Why is having teeth and gums a luxury, not a necessity? Your thoughts? I 100% agree with you. It should be part of healthcare. Why we've segmentized, and basically said this part of your body is paid for this way. This part of your body is covered by this. This part of I agree 100%. I don't think it's ever going to be included in healthcare because medical insurance doesn't want to cover it. They want to cover the pieces they're covering now and not anything additional. Unfortunately, dental insurance is not really insurance. It's a rebate. It's, $1,000 you get a year for as a rebate. And, that has not increased since about the 1960s and 70s. And dental care has increased in cost exponentially since the 60s and 70s. The cost of us to provide it for you has increased exponentially. So dental insurance has not kept up with inflation in any way, shape, or form. So it's a rebate at this point. This is why we encourage things like health savings accounts that you can use for this. There are third-party financing programs you can use for it because it's true. It's true. Having teeth and gum health shouldn't be a luxury. I agree with you. So that's why I work so hard to teach you how to take care of things at home too. Make sure you're using the proper vitamins, the proper minerals, the proper tooth care products so that you can keep healthy at home without having to incur the expense of the dental work. I saw a video saying something, even though they are going in sideways, they will straighten out. Is that a true possibility? I'd really rather not get my wisdom teeth removed. Okay, so again, we're talking about wisdom teeth. If they're coming in sideways, so let's talk about over here. I have to get my head right here. If they're coming in sideways, but there's room for them to straighten out, then they may possibly. It's all about the room. So you have to look and see, is there room between the front part of the jawbone here and the back tooth in your mouth? Is there room between those two? If there's not, there's no way it can straighten out because there's no room. So that's the key. My 1-year-old has a strong lip tie. Should I have had that fixed? I heard it's from a tight fascia, which could affect the whole body. Absolutely. So tongue tie and lip tie both are fascial based, and it can affect the whole body and tightness along the whole thing. A lot of times a craniosacral therapist can help with that. We do recommend those lip ties be corrected, but not at 1. Usually we wait till a little bit older because right now they're going to have to be sedated. So it's either a few days old or 3 or 4-year-old where we're able to do it without sedation. All right. My 12-year-old daughter has a cavity in her molar between the teeth. Will the tooth powder and mouth rinse get into the cavity hole? It depends on the size of the cavity. If it's all the way through the enamel, no. If it has not gone through the enamel, what I recommend is you brush and floss, or brush and rinse, and then you're going to floss that hydroxyapatite down into that tooth. You're also going to want to do the minerals from the inside. That's the best way to get to cavities between the teeth. So again, vitamin D3, K2, and minerals from the inside to help build. How do you fix a failed root canal, and can we remineralize it once it's fixed? The tooth, well, there's no way to fix a failed root canal because what it is it's an infected tooth, and the infection is because there's dead tissue inside of the tooth. So as long as the tooth is there, there is no way to fix this. You can get a root canal, you can get a root canal retreated, but it still leaves dead tissue inside the tooth. So if you've had a root canal and it is infected, the answer is the tooth needs to be removed, regrow bone, and then place a dental implant. What can you say about the longevity of zirconia implants? I will need 3 implants from teeth pulled after failed infected root canals. So what I know right now is that they're lasting as long as we've had them. That's the issue, is that titanium implants have been around for 30, 40 years. Zirconium implants have been around for 15, 20. So we know they last 15 to 20 years, but we don't know 30, 40 because they haven't been around that long. So we hope, and we're seeing a lot of what's called biologic compatibility. The body loves zirconia implants. Will they last 30, 40 years? We don't know yet because they haven't been invented that long. We sure hope so. I sure hope so. I had a black bottom molar removed over 30 years ago at age 15. What do you suggest now to fill that space? Well, most likely your bone is basically it regresses or resorbs quite a bit. The bone does if there's not a tooth there. The bone holds a tooth and it has a job to do. If there's no job to do, the bone actually goes away. So most likely you're going to need a bone graft in that area if that was 30 years ago. But there's great ways to do bone grafts now. We have a phenomenal surgeon in our office that does this. So we do a bone graft, rebuild the bone, and then a ceramic dental implant. Okay, a couple more. I feel like there's too much wrong with my teeth by the time I found biologic dentistry. Is there hope? There's always hope. And the big thing that I want you to do at home is to keep the things that are healthy, healthy. So what does that mean? That means vitamins. I can't reinforce this more. Vitamin D and K, hydroxyapatite, all these things at home. 3-month dental visits are easy. They're inexpensive. Go and make sure things are on, you're on top of things. That's what I always tell people. Get to a holding pattern where nothing's getting worse. So the things that are good now are staying good. And then slowly chip away at the things that aren't good right now. But at least don't let anything get worse. Are there studies in the long-term effectiveness of dental implants? Do they last forever, or do they have to be redone? There's a lot of studies on the longevity of dental implants, but most of them have been done on titanium implants, and they're showing very, very good longevity. My implant, which is titanium because it was the only thing at the time, has been in since I was in my early 20s. So that's, almost 30 years now, no problems. And I don't anticipate I'll ever have to have it redone. Is that always the case? Not necessarily. There's a lot of factors that go into this: bone strength, overall health, gum health, a lot of things, but we hope that they're a very long-term solution. Are Invisalign removable braces as good as metal train tracks? It depends on what your goal is. So we use them for pretty much everything nowadays. There are some things that we have to do with metal braces, but it's very specific and selective. It's when we need to move teeth after healing a jaw joint. So there are a few things that we have to do, but really the removable aligners are really great nowadays. Between the fillings that can cause side effects in the tongue. Okay, I know that there's what happened after the orthodontist. Yep, very good. Is there any way to resurrect a dead molar with ozone shots? Example, extract number 3. It looks like I need to have a sinus lift too. No, because the tooth is full of dead tissue. Full of dead tissue. When it's full of dead tissue, it's going to attract bacteria always. So there is no way to resurrect it. I hope at someday in my future, in my career, there will be. But at the moment, I can't tell you another one. On a homestead note, yay, I saw you watered your chickens using a bladder of some sort to avoid mold. How do I go about that for my chickens? Actually, so we just have, what we use is we have a bucket that has little feeder thingers that come out of the bottom. We got it off of a guy on Facebook somewhere. And that's just what we use. But we do add a little bit of apple cider vinegar into that for the health of the chickens. But my husband, he just cleans it. He just takes that bucket and he scrubs it clean with a little bit of soap and cleans it about every 4 days. So that's the best way to avoid mold. Okay, we're about to the end of this one. MK2, that's right. For K2, it's MK. You can actually do MK4 or MK7, either one. Boron is great for bone health. Yep. How do I find someone like you over here in Germany? That's a great question. You're really going to want to focus on looking up online, holistic, biologic, biomimetic. Those are all words you're going to look for, and you're going to ask them very specific questions like, how do you take a tooth out? Do you use ozone? How do you safely remove mercury fillings? What's your stance on root canals? Ask them these questions on the phone. Ask them. Okay. Longevity of dental implants with Ehlers-Danlos syndrome. It's a great question. Really, Ehlers-Danlos syndrome doesn't affect the bone as much as it affects connective tissue. So I believe I'm a carrier for EDS, for Ehlers-Danlos. I believe my son has it just at a low level. We don't express a lot of the symptoms, but again, my implant's been in for over 30 years. Is your toothpaste safe for ceramic crowns? Yes, it is safe for ceramic crowns. It is very safe for ceramic crowns, which is great. All right, I'm going to try to see if I can get knocked through a couple of these real quickly, and we got to be done. Anything, abfractions, there we go. More abfractions, more susceptible to cracks, cavity, or infection. Abfractions are gum line areas. Oh, I didn't get rid of that. Oh, well. Are gum line areas that have basically broken out because of flexure. So it's more due to the way your teeth are hitting and the flexure point on them. So they are more prone to cracking, not necessarily cavities or infection, because it's just a fracture point on the tooth. Anything to do to fix a tooth that has been ground down? Well, the first question is, why has it been ground down? Was that dental or was that you? And then, yes, add lots of minerals back in and we can restore and rebuild it with dental materials. Is sedation safe for people with MTHFR? So MTHFR is a genetic variant where you don't metabolize things the same way. It is safe. You may not respond to the same way, which is why I recommend IV sedation with the nurse anesthetist, because you're going to be monitored the whole time. What is important for the dentist to do when removing a wisdom tooth? I've heard one should remove the ligament. That's exactly right. The ligament should be removed around that wisdom tooth area, and then we treat it with ozone to make sure there's no bacteria in there, which there shouldn't be, if it's a wisdom tooth area. And then we actually add stem cells called PRF to the area so that the bone has something to grow to, so it will grow. My 8-year-old is constantly mouth breathing. Started the Healthy Start program with a mouth guard and it's still mouth breathing. Tonsils are enlarged, of course. Any recommendations? Absolutely. I would recommend doing some allergy testing, but I like to do it with NAET. It's spelled NAET. It doesn't require any of the poking and needles and any of that kind of thing. They're going to use some energetic testing to find out what is sensitive. And most likely those swollen tonsils are because there is some sort of a food sensitivity, and that's impacting him being able to nose breathe. Going on the first visit for a 20-month-old, is it okay to do x-rays on her teeth? Most likely they're not going to be able to do x-rays on a 20-month-old. They're going to have to hold tooth still. So yes, if they can do them, but I doubt they're going to be able to do them. What is the best way to prevent cavities? It's going to be clean your teeth with hydroxyapatite and minerals and vitamins. That's basically been the talk today. I cracked a lower front molar around the filling on a popcorn kernel. I have no pain at all, but there's an awful smell and taste. Is this normal for a cracked tooth? Well, pain is good, but you need to go get it fixed. So just go find out what's going on with that tooth. That smell, most likely there's something where bacteria is being trapped. Is hydroxyapatite safe for kids 2 years old? Absolutely. Try my citrus formula. It's fabulous. Kids love it. How long to wait to do bone grafting after taking out the corroded implants? So bone grafting should have happened day of. Usually they'll do some, and then they'll do some more at about 3 months out. My son suffers, sorry, I'm going fast because I'm trying to get through the rest of these. My son suffers from chronic canker sores, already uses sodium lauryl sulfate-free products, takes a vitamin D12 supplement, avoids citrus. Any other suggestions? Yes, zinc. Zinc and vitamin B6 is often the difference. So try those two things. You're going to add zinc and vitamin B6 and see if that helps. Lysine is also one that will often help with canker sores once you have them. 6 years in the dental field, and I've never seen sideways teeth, even with room come in. I've never seen sideways teeth, even with room come in correctly. Exactly. So basically what we're saying is if teeth are coming in this way, are they going to straighten out? It's really unlikely. If having periodontitis, can I have my bottom teeth straightened? Yes, but periodontitis typically means that you have bone loss here. So it's going to be iffy that you're going to want teeth moved. You're going to want the gum disease treated first before you start moving teeth. How long does one have to wait from getting an implant to having a crown cemented on top? It depends on the implant type, but for us, it's 4 to 6 months. Sometimes doctors will say 3 to 4 months. I would like to wait a little longer because I don't want to stress them too soon. I have a cyst between 22 and 23, I believe. It's been on watch for a year and a half. What do you recommend? If it's a dead tooth, then that tooth needs to be addressed. So you need to have those teeth vitality tested to see, is it a tooth that's the problem? I was told I might need a root canal. What should I do? Find a dentist that does something called biomimetic dentistry and uses ozone. They're going to go, if the tooth's still alive, they're going to remove the deepest decay, fill over it, and keep the tooth alive. That's the goal. That's the goal. You find somebody who has ozone. I had a tooth removed, DNA test on root, possible Lyme disease. What now? Well, what now is you're going to make sure that all the infection's out of your system. That's the key. So immune strengthening, lots of elderberry. Go check out my elderberry supplements. Elderberry Plus Immune is awesome. Go use that and see if you can't build up your immune system. All right, we got through most everything today. Very good. Thank you all for being on here. We do this every week. So I'll be back next week. And I love your questions. Keep them coming. Keep sharing. Keep being interested in this. I will share as long as you have questions. Thank you all. Have a fabulous week.